I think our approach to mentorship is rooted in our culture, which is, I view my mentees as my colleagues, and certainly certainly we. I would say the mentoring relationship is most strongly established during academic development time, because we're working very, very closely with usually, one or two residents over a 2-year period, and just get to know them really well. And so the mentees that I've worked with through the academic development time, I can't stress enough that like they become my colleagues, people I rely on, people I ask questions for. They know, and it becomes, we share family stories. They know all my kids, and they end up coming to the house. I'm texting them, and the thing is that now this is my 5th year on faculty here at Michigan. The thing that's really special is that relationship doesn't like end when the resident graduates from the program. So now some of my first mentees are in fellowship or looking for jobs. And, so the last time you interacted, well, one of them texted me this morning about, some upcoming job interview and things like that. So I would say it's extremely strong, and it very rapidly becomes really a colleague, relationship where we believe strongly in bidirectional learning. So we learn as much from our mentees as they learn from us. So I think that's how I conceptualize it, and I'll turn over for some other examples.
I had kind of a cool one that I'm happy to share. So yesterday, I was able to share a Grand Rounds presentation at the University of Wisconsin with Dr. Anglesby, and it was a talk that he had never given before that was based on a perspectives piece that we had written together a couple of months ago. And so not only was the sort of development of the talk very much sort of a shared 50-50 endeavor, but I mean, how many mentors are just like, you know what, I'm going to take one of my mentees with me to sort of give this talk at a major academic institution, no pressure. And so, that's the type of sort of promoting and cultivating that he's been able to do for me. But at the same time, he's also the person who brought my 2.5-year-old a birthday present because he turned 2 as the pandemic was starting and his birthday party was canceled. So it's one of those kind of relationships that is very much multidimensional. As far as there was a question about sort of how you connect with people who become your mentors, I met Dr. Anglesby when I was an intern on transplant and walked into the OR to give the fellow an update about a patient on the floor. And Dr. Anglesby asked me if I didn't do medicine, what I would do. And I told him I would have a sustainable farm and teach yoga. And that was sort of enough to sort of kick off a mentorship relationship over many years. So I think that it really just has to do with the way that we get to know our faculty members in all of our different interactions. These relationships really sort of naturally blossom. And then with the upcoming mentorship programs that we have, there's a little bit more structure offered as well. So I anticipate that people will end up having sort of more formalized mentorship relationships, as well as the organic ones that just naturally blossom within our program.